As the 2024 recipient of the Dr. Levi Watkins Jr. Ideals Award, I am grateful to the Planning Committee for asking me to share a few remarks. The actual award reads, in recognition of outstanding service and commitment to the principles of Dr. Martin Luther King Jr., and this is an absolute honor. And reflecting on this honor, I want to start by thanking many of the people who've supported me along this journey. I want to first thank my family. I have many family members, some of whom were able to join me at the award ceremony in Baltimore, and others who watched online. But they all have supported my commitment to use the gifts which I've been given to help others in need of care. And I'm proud to continue that legacy. I'm also grateful to my colleagues at Sibley Memorial Hospital in Washington, D.C., who watched the ceremony virtually, and even more importantly, partner with me on a daily basis to provide mental health care that I'm extremely proud of. From our inpatient unit on 7 West to the care that we provide across the hospital and to our outpatient community, but more importantly, to everyone that volunteers for our outreach initiatives, I am grateful to you. The support that I feel from our institution at Sibley is immeasurable. Now, the timing of the COVID pandemic coincided with a different pandemic of sorts, resulting in a movement to speak up about racial injustice. While Hopkins did their own moment of silence in honor of the victims of these injustices, Sibley did the same. We met in our garden and we shared a collective moment of silence. As one of the people who sent emails asking my colleagues to join, the response was heartwarming. And for that, I remain grateful. Another group that I want to thank are my colleagues in the Department of Psychiatry at Johns Hopkins Hospital in East Baltimore. If Sibley is where I'm able to hone my skills, Hopkins is where I learn them. Our department is led by Dr. Jimmy Potash, who was front and center when I received my award, but he's also essentially been front and center throughout my career, starting when I was a resident at Johns Hopkins in that department. In the spirit of Dr. Watkins, our department has a commitment to providing a diverse learning environment. While this includes race, it also includes gender identity, educational background, different cultural beliefs, and the list goes on. We realize that when trainees learn in a diverse environment, we provide better care, and our patients are better off because of that. My growth as a physician, my diagnostic acumen, my ability to explain mental health diagnosis and treatment to patients and their family members is from the learning that I received from our diverse community at Hopkins. And again, I'm very proud of that component of my training. Dr. Levi Watkins Jr. made it not only acceptable, but expected that people would speak up if a drive towards inclusion and a communication about the importance of diversity was not happening. And that's what I saw in the audience during the MLK celebration this year. When I accepted my award and when I looked out, I saw all of the things that makes Hopkins special. Trainees and attendings and other team members sitting together and taking time to support one another. I'm reminded of a quote from Dr. Martin Luther King Jr., which states, "If you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. But whatever you do, you have to keep moving." This is my message to the trainees at Hopkins and really everyone along a career path that they're pursuing. It is worth it. Keep going. The gifts that you have, the work that you're putting in, it will pay off. And I looked into the audience. I saw people that were there. And I remember thinking this is a full circle moment, because I remember sitting in the audience as a resident and leaving with much motivation, feeling that I was a part of a community that would support me. And my hope is that when people leave this setting, when they left the celebration, that they also felt supported and feel like they can continue moving forward. My final thought in reference to this award, and in particular celebrating the lives of Dr. Martin Luther King Jr. and Dr. Levi Watkins Jr., is a note about mental health in the Black community. Statistics show that Black Americans are 15% less likely to seek mental health treatment compared to some other racial groups. Additionally, when it comes to participation in clinical trials, Black participants make up about 5% of most study populations. Now, many people will state that there's a stigma associated with mental health. Others will state that there's been so many wrongs in the past for minorities who've participated in research that they're afraid to move forward. But part of the dream of Dr. King and the vision of Dr. Watkins emphasized the importance of equality and making room at the table. Mental health care is a basic health right that everyone should have access to. And that's the challenge that I accept from Dr. Watkins, to continue to fight for that equality, especially in the realms of trainees and in the realm of mental health. Again, I appreciate the award and I thank everyone for their support.